measuring outcomes that matter to patients. It's about finding out what value is for groups of patients, but then also using that same information to tailor the care to the needs of individual patients. I think this is not something that you can call into being simply by having a law or having a government saying this is what we should do. I think we find it a very exciting initiative, but it's also really complicated because the question is, how do you do it practically, conceptually? How do you substantially, what are core outcome sets that matter to patients? So you need to try what works. It's a bit trial and error sometimes maybe, and that's why we're also interested in this project, because we see it as a demonstration project in a sense.
I've looked into the fact that having enough staff to run the hospital system is difficult, and the patients are in center of all this. And if we give them the possibility to supply their data and their knowledge about their disease, it's beneficial to patients, but also to the system. So transforming healthcare actually calls for more involvement of patients and more use of their data and reuse of their data together with the patients. So that's a clinical view from a physician in the system. Mm-hmm. We need more data from the patients, and it's an easy way to get them. Mm-hmm. The system view is actually, we introduce a lot of new treatments, and it's difficult for us to have the time and the power to collect all the necessary data to know if it was really beneficial to patients. So this systemic view, we need to know more about new and actually old treatments. Are they beneficial to patients, and what is the actual value? And I think we share a common interest with the industry and other healthcare systems in trying to evaluate both old and new treatments of the patients, even more than we have done until now. And I think actually the patients are perhaps the least used resource in healthcare systems. We tend to regard them as customers, but actually they are the central users of the system, and they know much more about their condition and the treatment results and how they're living than we do. So if we can transform the system to accept that they have a much bigger role in the whole picture, that will be beneficial to patients. They will have the possibility to make better decisions on their own and together with us, because they're more informed. I'm a political scientist. I study governance issues in healthcare. So for me personally, the governance aspects of this project are the most interesting and that's the reason why I'm involved, because it's as Jørgen said, it's you want to bring value to patients and the public. There's a tension in those two objectives. What is value for an individual patient might not be of value to society as a whole, and yet we want to combine those two goals in one project. How do we do that? How do we explain that to people who share their data? But what happens if the result of that sharing data is that the drug they're using might no longer be reimbursed because we decided it isn't of value to society? Will they still continue to share their data? I mean, that's really interesting questions for anyone who's keen on studying governance in healthcare. I think we should focus heavily on how we involve patients in the best way so they have a real value. Because we can do a lot of things behind the scenes with the data, but if the patients and the citizens do not see any value, they will not use the possibility. And I think that's a critical area.
To collect data from the patient on outcomes that matter to patients, and that you do that continuously and in a standardized way. I think that is very important for and very interesting for HTA, because health technology assessment is not just a one-off decision on the reimbursement of a new drug. I mean, that's one aspect of it, and we still tend to take that decision, that first decision, whether or not something will be reimbursed, on the basis of randomized controlled clinical trials, as the most credible evidence that we can get if you're looking at an intervention that you can study by means of a randomized controlled clinical trial. But it doesn't stop there, because once you have something in your benefits package, you still want to know if it works the way it was claimed to work, or if it works the way we saw in the clinical trials. So you want to follow up. You want to use information, real world data, for things like reassessment, or maybe managed entry agreements, etc. So this is a potentially very important data source. And up till now, at the National Healthcare Institute, we've been involved in research projects looking at real-world data as a source for this reassessment, and also linking it to payment models. But one of the problems that we encountered was that you don't have access always to relevant data sources, or if you do have access, they don't contain the variables you need from an HTA perspective. So any project that offers that is built on the vision that H2O has is from that perspective relevant, not for us only as the Dutch HTA agency, but also for HTA agencies elsewhere in Europe. And I think similarly, organizations that work on shared decision making should also be very interested in this project. But what I would like to add is that it's important not only to focus on the data-driven component, because shared decision making is about more than just having the data available. That allows the talk between the professional and the patient about what the options are and what the expected outcomes are. It's also very much about the talk between the professional and the patient, and not only about the options, but also about the preferences. What is it that matters to you really? What do you find important? And how can we align this with the data we have on outcomes for people like you?
Others would perhaps have benefits from looking into the H2O to look at where had we failures? Mm-hmm. Where did we struggle in the different countries? And where did we actually have success? Because I think all countries, all organizations are trying to look into real world evidence and patient reported outcomes. And it's not that easy. So just sharing the information about failures and successes will be beneficial to many, because quite often they are hard earned. So it's also nice to share them. They become more and more common, rare diseases. So we need to do something about the numbers, and collecting data from all patients treated, even when we had few data from the beginning, but just continuing collecting patient-reported outcomes data will give a much larger number of information and reports. So that is beneficial to all of us, because we are going into a new era where we will use new drugs, new ways of treatment very early on in the process with less evidence, and we will do it in rare diseases where there will be evidently less evidence. So we need to try to collect all the data we can get